Hello everyone and welcome to Module 4. This week our focus is going to be on urology. So if you have already actually taken your Clinical Skills and Diagnostic Procedures 1 course, it goes very similar to that of when we talked about nephrology. But with this unit we have quite a few chapters that we're looking at. We're actually looking at Chapter 31, all of it. Chapter 38, pages 879 to 882. Chapter 40, page 923. I will not actually focus on that specifically in this video, but it does go over a great procedure that you do need to know about. And then, chapter 46 in its entirety as well. So let's go ahead and get started. So chapter 31 is focused on the urinary system and also talking about, like we talked about in your Clinical Skills 1 course, the nephrology unit. The organs found within the urinary system are your kidneys, ureters, bladder, and urethra. Your kidneys are two bean-shaped organs located at the back of your abdominal cavity. The kidney has both an external and an internal part. The external structure of the kidney is called the hilum, and this is the opening for the ureter, which connects to the renal pelvis that then collects urine. The internal structure of the kidneys are separated by two parts as well, the renal cortex and the renal medulla. The renal cortex is a soft and dense and is considered the outer layer of the inner part of the kidney. The renal medulla is found deep within the kidney and it forms the renal pyramids. Now, when speaking about the kidney, it's also important that you know that the functional unit of a kidney is called a nephron, and there are over 1 million nephrons in each kidney. The ureters are two muscular tubes that carry newly formed urine from each kidney down into the bladder. Each ureter is about 8 to 12 inches long. Your bladder is a hollow muscular sac that is a reservoir for urine, and it can be found in your pelvic cavity. And finally, your urethra. This is a tube of muscle, also known and responsible for voiding urine. It extends from the bladder into the urinary meatus. For men, their urethra is about 7 inches long, where females is only about 1.2 inches long. Now, it's also important that you understand the structures, but you also understand that your system produces urine. The formation of urine can be divided into 3 parts. That can be your filtration, reabsorption, and secretion. Urine consists of about 95% water and 5% solid substances. Your bladder can hold up to 500 milliliters of urine, but you'll feel the need to void when it is filled about 300 to 350 milliliters full. On an average, a person should urinate about 1,000 to 1,500 milliliters of urine every day, and normal urine is clear or has a straw yellow color to it. With this unit, we also talk about some of the most common disorders and diseases. Most importantly, right at the top there is going to be a UTI. That's probably something that you'll deal with and see most often. You can also have renal colic, which is a kidney stone, renal failure, which we'll talk about a little bit later, incontinence, dysuria, or even renal artery stenosis. So I'm going to leave that part of the chapter for you guys to really read and focus on, and I would highly suggest it because it does come back in your written exam, your final exam, your CMA exam. All of those things are going to come back into play at that point. Let's move on to chapter 38, which is assisting with the reproductive and urinary specialties. So the function of the urinary system is to filter and remove waste products from the blood helps to maintain electrolyte and pH balance, and secrete waste from the body in the form of urine. And it also helps to regulate the red blood cell production and blood pressure. Symptoms of the urinary tract disorder vary, as do age-related health problems. Most people should urinate 4 to 6 times per day and excrete about 2 quarts of urine per day. Some conditions that could happen here that we need to pay attention to are prostate conditions, renal failure, and bladder control. Prostate conditions have something we have to focus on, which is BPH, or benign prostate hyperplasia. This is an enlargement of the prostate gland that may occur after age 50 for men. What it does is it restricts urine flow and can result from urinary retention, interruption of the flow of stream, or difficulty starting to urinate. You also have to think about prostate cancer, which is a slow-growing malignant tumor of the prostate gland, affecting 1 in 4 men in the United States. The cause of prostate cancer is unknown, but age, heredity, and a high-fat diet can increase this risk. In order to test for prostate cancer, men will have what we call a PSA drawn, which is a protein-specific antigen, and it's a blood test that can help to diagnose prostate conditions, as well as having a digital rectal exam where they screen the prostate. Renal failure is the ability of the kidneys to adequately filter metabolic waste products from the blood. It can be acute or chronic. Acute renal failure has a rapid onset of a few days to a few weeks, where chronic renal failure is a slow-growing progressive decline in the renal function over a period of several months to several years. And bladder control can be a very embarrassing situation for anyone. It's typically caused by poor muscle control, trauma, improper placement of organs, or it can actually happen after childbirth as well. So there are some ways that we can help with that. Typically it's surgery or doing some Kegel exercises to help kind of strengthen your bladder control. We're going to move to chapter 48, which is talking about your urinalysis. The formation and secretion of urine is a vital process. Acting as a filter, the kidneys remove significant concentration of unwanted materials from your blood. Urine can provide significant information about the function of your urinary system and other diagnostic information. For this reason, we have a test called a urinalysis. A urinalysis is testing and evaluation of urine. It's typically performed for 3 reasons: either a routine evaluation, diagnostic purposes, or to monitor a course of treatment. As a medical assistant, you will play a key role in the urinary testing and evaluation. Medical assistants will collect the specimen, which will then include clearly explaining to the patient the method of collection, and you need to make sure that you use terminology that would be easy to understand. You will also be responsible for labeling the sample and properly sending it to a lab if you are not the one also performing a test. Now, there are a few different time-specific tests. We have random specimens, first morning specimens, 24-hour collections, and 2-hour postprandial specimens. A random specimen is just as it sounds. It can be taken at any time of the day and is a non-sterile specimen. This is the most commonly collected urine specimen that you will deal with. The first morning specimen is considered the most concentrated because it has remained in the bladder overnight and is best for testing for pregnancy, urine cultures, and microscopic exams. The 24-hour urine specimen is a test used to determine glomerular filtration rates of the kidneys and checking specific hormone levels. It's also used to check for specific metabolic abnormalities. And a 2-hour postprandial is a single void specimen that is collected 2 hours after a meal has been eaten. There also may be times that a patient cannot give a sample easily or needs to have specific instructions. So when that is the case, we have things such as clean catch specimens, catheterization specimens, pediatric specimens, and suprapubic. 24-hour clean catch selections are used to determine UTIs and other dysfunctions. The patient will need to sterilize or clean the urinary meatus prior to obtaining the sample. A catheterization is a process of inserting a flexible tube-like catheter through the urethra into the bladder, and this type of specimen is good because it is contamination-free. For pediatric patients, it's hard for them to collect a sample in a cup, so what we do is we place an adhesive pediatric urine specimen bag into their underpants or diaper to obtain that specimen. And a suprapubic is done by inserting a sterile needle into the patient's bladder through the abdominal wall and using a syringe to draw back our sample. Now, the urinalysis itself typically has 3 pieces to it: a physical urinalysis, a chemical urinalysis, and a microscopic. Physical urinalysis is typically where we're going to look at the physical characteristics such as color, clarity, odor, and quantity. Chemical urinalysis, we typically use dipstick tests, and what this is it's a stick that will have small chemically treated pads that will react with specific chemicals in the urine to allow for the ability to measure the amount of chemical within the urine. It will look at the pH, protein, glucose, ketones, blood, bilirubin, urobilirubin, nitrates, leukocytes, and the specific gravity. The microscopic urinalysis is a type that will define the type, it will identify the type and approximate number of organisms present in the urine specimen. This piece of a urinalysis is not CLIA waived, meaning that you as a medical assistant cannot perform this. It has to be somebody who is specially trained in that. You can do a physical and a chemical urinalysis though. Alright guys, that's all I have for your Module 4 content. Please make sure that you are reading through those chapters completely. That's chapter 31, 38, 48, and that will help to fully explain those units for you. Now this week you do not have a discussion board, but you do have one case study, which is looking at UTI symptoms. So again, you've been given a scenario situation with a patient that's come into your office for an appointment. She thinks that she may have a UTI. So what you'll need to do is answer what type of questions you would ask the patient. Why is it important to ask those questions? What standing order might the provider have in place for this type of complaint? And you'll want to make sure that you write this assessment in a properly formatted APA Word document that answers all of the questions above in detail, and you'll want to submit it to the Dropbox no later than Sunday, July 30th by midnight. Alright guys, that's all I've got for you. If you do have any questions, comments, or concerns, as always, please make sure that you're reaching out to me as soon as possible. You can reach out to me via the course messaging in Blackboard, or you can actually give me a call at the Rockford campus. My direct line is on your course homepage in the top right-hand side up near my photo. I hope that you all have a great Module 4, and I can't wait to hear what you guys come up with for your case study. Bye, everyone.